Losing weight too fast on Wegovy or Zepbound can become dangerous before the scale looks alarming. A drop above 2 pounds weekly is not automatically unsafe, especially at a higher starting weight. The warning appears when fast loss comes with weakness, dizziness, vomiting, dark urine, or falling strength. Speed alone is a signal, but speed plus symptoms demands action. Wegovy contains Semaglutide and Zepbound contains Tirzepatide. Both reduce hunger and help smaller meals feel satisfying. They can also slow how quickly food leaves the stomach. That combination may sharply reduce calories, protein, fluids, and salt. Early scale changes also include water and less food inside the bowel, not only lost body fat. That is why the first few weeks can look dramatic. Someone may lose 6 pounds after nausea, smaller meals, and fewer carbohydrates. Part of that drop may be water stored alongside carbohydrate. The early drop often combines water and fat loss, so the scale can temporarily exaggerate fat loss. A common weight loss target is about 1 to 2 pounds per week. That number is useful, but it is not a hard safety wall for these drugs. A 300-pound person losing 3 pounds weekly is losing about 1%. A 130-pound person losing 3 pounds is losing more than 2%. Body size and timing change the meaning of the same number. A brief early drop after starting treatment differs from steady rapid loss lasting many weeks. Review the trend over 3 to 4 weeks unless warning symptoms appear sooner. One unusually low weigh-in should not control a medical decision. Dehydration is one way, rapid loss becomes dangerous. Nausea, vomiting, diarrhea, or simply forgetting to drink can reduce blood volume. Your mouth may feel dry, urine may become dark, and standing may cause lightheadedness. The kidneys then receive less blood, causing acute kidney injury, a sudden drop in kidney function. This problem often develops during dose increases because stomach symptoms may intensify. The scale can fall quickly while the body is actually losing fluid. A lower number that comes with reduced urination is not a victory. Persistent vomiting, repeated diarrhea, fainting, or inability to keep liquids down needs prompt medical review. Blood sugar medicines create another risk in people with diabetes. Wegovy or Zepbound alone rarely causes severe low blood sugar. The risk rises when insulin or certain tablets continue at doses chosen before major weight loss. Sweating, shaking, confusion, or sudden weakness should prompt a blood sugar check. Even without diabetes, very low appetite can leave the body underfed. A person may eat only crackers, fruit, or a few bites daily. The scale keeps rewarding that pattern, but the body receives too little protein, iron, vitamin B12, and other essential nutrients. Fatigue may appear before blood tests show a clear problem. Hair shedding, feeling unusually cold, poor wound healing, constant weakness, or repeated dizziness can signal that intake is inadequate. These symptoms are not proof of one deficiency. They show that the treatment plan needs review. A medication should make eating manageable, not make basic nourishment nearly impossible. The impressive weekly loss may reflect poor tolerance rather than superior fat loss. Two patients can lose the same 10 pounds with very different outcomes. One eats balanced meals and stays active, while the other vomits, skips protein, and becomes weaker. The scale cannot tell those stories apart. Rapid loss can also reduce muscle. Weight reduction usually removes both fat and some lean tissue, which includes muscle and body water. Trials with Wegovy and Zepbound show most weight loss is fat, but some lean tissue also decreases. The goal is to preserve strength and function while fat decreases. Watch ordinary tasks instead of obsessing over a body scan. Stairs should not become harder. Rising from a low chair and carrying groceries should not suddenly worsen. A falling scale with falling strength is a warning pattern, especially in older adults or anyone already living with limited mobility. Protein and strength training protect function better than chasing the smallest possible meal. Protein needs vary with kidney health, age, and activity. A doctor or dietitian can set an appropriate target. Strength work may begin with bands, machines, body weight movements, or supervised therapy when joints or balance are limiting. Rapid loss also raises gallstone risk. During fast weight reduction, extra cholesterol enters bile, the liver's digestive fluid. The gallbladder may empty less often. Stones can form, or previously silent stones can become painful. Wegovy and Zepbound also carry warnings for sudden gallbladder problems. Pain under the right ribs after eating, pain spreading toward the back or right shoulder, fever or yellow skin needs medical attention. Severe upper abdominal pain that persists can also suggest pancreatitis, meaning inflammation of the pancreas. Do not dismiss these symptoms as ordinary nausea from the injection. A safer trend preserves hydration, nourishment, strength, and daily function while weight falls. The weekly number matters less than those 4 areas. Someone losing quickly without symptoms may only need closer monitoring. Someone losing more slowly with vomiting, fainting, or weakness may already be in danger. Protecting hydration is not just drinking a huge bottle at bedtime. Small, repeated amounts are usually easier when nausea is present. Broth or an oral rehydration drink may help replace salt during vomiting or diarrhea. People with heart failure or kidney disease need individualized fluid advice rather than a standard target. Use a weekly record. Track weight consistently, but also record vomiting, bowel changes, urine color, meal tolerance, and strength. Note whether symptoms followed a dose increase. This gives your doctor a useful pattern instead of one scale number or vague memory. Do not increase the dose automatically because the calendar says another month has passed. The best dose is not always the highest dose. If appetite is already extremely low or symptoms are limiting intake, your doctor may delay the next dose increase. They may also lower the dose or investigate another cause. Also, check whether another illness is contributing. An overactive thyroid, uncontrolled diabetes, infection, depression, or another medication can accelerate weight loss. Assuming every pound comes from Wegovy or Zepbound can delay the correct diagnosis. Unexpected loss deserves a broader review when the pattern does not fit treatment timing. Blood tests are not required after every quick drop. They become more useful when symptoms suggest dehydration, anemia, nutrient deficiency, or medication-related low blood sugar. Tests may include kidney function, salt levels, blood counts, blood sugar, and vitamins chosen from symptoms and diet. Contact your doctor soon when rapid loss continues for several weeks, especially near or above 1% of body weight weekly. Contact them sooner for persistent vomiting, reduced urination, new weakness, repeated low blood sugar, or inability to eat enough. These are reasons to adjust care, not reasons for shame. Seek urgent care for fainting, confusion, severe dehydration, blood in vomit, or intense abdominal pain that will not ease. Yellow skin, fever with right-sided abdominal pain, or severe pain reaching the back also needs urgent assessment. These symptoms can represent complications that require testing rather than home observation. Fast loss is not automatically dangerous, and slow loss is not automatically safe. The dangerous pattern is weight falling while hydration, nutrition, strength, or organ function deteriorates. Keep the result that improves health, not merely the result that produces the most dramatic screenshot. Treatment should leave you lighter and still functioning well. Medicine simplified. That's what this channel does. If you want more, hit subscribe.